He has a very bad periodontal disease. Have lost a lot of teeth, and he has a significant bone loss.
I think the important part here, Dr. Taweel, is to make people think that everything is possible and that we are two professionals that we're gonna do everything in our power. Welcome everybody to Romani podcast. This is the second edition of second chapter of this journey. We are faces behind smiles. I'm here today with my brother, I would say my colleague, and a person that I trust with my eye closed. So Dr. Taweel, there is no words to present you. There is no words to express what I feel for our friendship. So I just gonna ask you to introduce yourself.
Yeah, thank you so much, Dr. Romani. Actually, I'm so happy to be part of this broadcast. So happy to be part of your journey, giving people nice, beautiful smiles. We've been working together for almost 2 years.
I would say 3 years.
3 years.
I would
maybe.
say 3 years.
Time flies. Yeah, we went to the same school. We know each other over there. We know how to do things.
I think God was good with us, put us together,
Exactly.
and having this same journey. And I mean, when we work together, we just enjoy the moment, right?
Yeah, of course. I mean, especially with some big, beautiful cases as well.
Yeah.
We need each other because, we always, as we say, 4 eyes is better than 2 eyes.
Definitely.
4 hands is better than 2 hands. And always we are a team. Thank you so much for having me here today.
So, Dr. Will, I want you to know that this podcast is it doesn't have nothing with money or with nothing. We're doing this podcast. I'm making you part of this podcast because I want that people know what is there that they can afford, that they can be part of, right?
Of course.
Because we're gonna speak about cases like Victor in a moment, but I just want you to answer questions that people has in social media, like how we became dentists in this country, right? I want you to explain me or to tell me a little bit about your story here in this country. I know everybody, and this is the beautiful of this podcast, because everybody in our class has different story. When I was in university, I have to tell you guys, it was very, very for me, it was very interesting. Listen, my friends, my colleague now, different story, different ways to get to the same point.
Of course.
So the most of our friends, we are I'm not old, but I'm in the 40s. But Dr. Taweel is the youngest of our group. But everybody has different story, but we are in the same room, learning about dentistry. So I think that was the most important, the most interesting part of our friendship. So I don't know if you can tell us about something.
Yeah, of course.
How was your journey up to here?
Any international students, spend a lot of time, a lot of effort to reach to the point that we are right now. And entails a lot,
Definitely.
Emotionally, talking about a lot of hours of study, a lot of hours of working, commuting. We have to sacrifice. We have to give away a lot of things because we love what we're doing.
Definitely.
And we want to be a dentist in this country, and we want to practice dentistry in this country.
And I know it was hard for you to be a dentist. What part of I know this part of trying to be a dentist in this country was very hard for you, because besides you have to study, you have to work, and besides you have to work, you have to be a dad, because when you were about in the process to be a dentist here, you had your first kid.
Exactly. Actually, I have to study first, and I have to study in a different language. So we have to take a lot of exams. We have to study the Dillon boards. We have to take the TOEFL exams. In the meantime, you have to do something on the side, to
survive.
To survive, of course.
Of course.
Again, it wasn't easy, but we enjoyed it.
I never believe you this, and I always tell you in your face, I never believe you because your English is very good. My English is so poor. But he told me he's always telling me when he got here to US, he didn't even know one word of English.
Yeah.
And because my friend is from Syria and he speak Arab, but he say, I didn't speak English one word, but I don't believe it's true.
I mean, exactly. I mean, Syria used to be a French colony. So we have, like, used to teach French instead of English sometimes. You have
You
the
speak
option.
French? You never
No,
told me.
I haven't even selected it to be my second
Okay.
language because
I
it was
was like,
tough for
what?
me, actually. So I found English is like a little bit easier. But again, I wasn't like that much of learning over there because, the curriculum mostly in Arabic. But when we got up here, you have to speak. You have to ask for food. You have to ask for help.
Tell
You
us,
have
tell us how you speak.
I
You
mean,
speak
first,
it, you speak
actually,
English, and
I
then
start
how
to
you
speak
speak.
Spanish before English, actually.
That's funny.
But
How you
again,
speak Spanish first?
I mean, of course, like interacting with people, with colleagues, you know, here and there.
I know
Again,
you wanna tell it.
uh,
I know you wanna say it.
but
But
again, when we start, going to explore more dentistry world with the professional people, we start to interact, we start to, learn more, and we start, to speak during our journey, even like learning and studying the dental boards. So
Yes.
we have to basically learn English. On the other hand, we have to study all the medical terminology and
Different terminology,
information.
yeah.
So you have to have your dictionary in the hand and your boards in the other hand.
Yeah.
So that will make it hard for us.
Yeah,
Yeah,
it
exactly.
was very hard.
So, but again, after I would say like 6 or 7 months in the country, uh, I would say like English. It wasn't that hard.
You got
Just,
lucky.
yes.
Guys, I would say everybody has the first barrier. It was the language. For me, it was super difficult. I was always hard-headed with English. I studied like 4 years of English, and even though my English is not good looking, but do you remember your first time? Like,
Of course, it was even tough to ask for help. It was tough to ask for anything else. But right now, thanks God, we speak it. We conversation with people. Everything right now English around us.
Yeah.
So thankfully, we are here right now.
what you can tell to like those people like right there, like they are listening to this podcast.
Like, of
What is
course.
the difficult part? The most difficult part for everybody. Imagine you are not here. Imagine you're not dentist. Imagine you are in front. Like it happened to me, right? I want to be a dentist. I love my career. I love dentistry. You know me. I'm very passionate in my career. So when I want to become a dentist here, I was in front of the computer. I say, okay, what I'm going to do now? What hell we gonna do that now, right? So my community, Peruvian community, is not big. Like we don't have forums like Cuban people has, for example. We have a lot of Cuban friends.
Exactly.
So my community, Peruvian community, we don't have too much forums about how to become a dentist here. So we have to go by. I have to go by myself and try to find my own resources to be a dentist here, right?
Of course.
So and then I always think, oh my God, English is so difficult. It's my first barrier. Believe me, English is, you're not gonna even thinking about English when you're at school. So there is a lot of things that you have to do for, like board exams. It's very difficult. They are very difficult now. Like before even it were, I think it's more difficult because there were 2 exams. Remember those exams?
Yeah, of course. I wouldn't actually forget these exams.
I
It
want to
takes-
forget those exams. Definitely. I think, you remember the
again,
first
doctor,
exam? It was like 8 hours,
Yeah,
800 questions.
I would say the first thing everybody has to have is a plan. So if you don't have a plan, the way you have to study, the way you have to organize your time,
Discipline, right?
of course, discipline and persistent as well. But again, you have to have a plan for yourself. You have to understand from where you want to start, and you have to understand the resources as well. Is very important because again, you can study these boards for, I would say, 5, 10 years. You wouldn't even finish them. But again, if you go to some, like boot camps, for example, or
Now there are boot camps, but
like,
before
w-
it
I
wasn't
would say
boot
like
camps.
it wasn't like if you go to some Facebook groups
Yeah.
that can somebody who had the exam like 3 or 4 days before, and somebody has some informations about the exam, about the questions.
That helps.
All helps. So I would say even for the TOEFL, okay, it's the way or the plan of study.
Yeah.
You have to have a strategy more than what you have to spend more hours studying. So if you have the strategy, um, you will be there. Yeah, I wouldn't say it is that tough, but definitely
Now,
it
guys,
needs
this
time.
is
Yeah.
this is the first part. The first part is English, right? Which I think for me was difficult. For you also
Of
was
course, yeah. Now we
difficult.
have to take it multiple
Second
times.
part is board, which is 10 times difficult. The two boards. And the third part, which is they consider the easy part, is try to apply to schools.
Try to apply the skills is another thing as
But
well.
this, I would consider that was the most difficult part.
It's very competitive.
And very
It's-
competitive
especially
and
with
very
internationals.
stressful.
It's stressful. It's competitive. It takes time. Um, again, the decision you have to take, because some people have to travel to the West
Yeah.
Coast if you live
Yeah.
in the East Coast. Some people
Yeah.
has to go down south. Some people they have families up here. They have kids. They have children, and they have working wives. They have to take the decision to move. So I would say it's really it's a tough decision to take. But if you want to be a dentist, you don't have any other options. You have just like
You have to
go
be. You have to have the
of
willing
course,
to.
you have to have the willing, and you have to accept the university decisions. If you got accepted in the West Coast, and you don't want to waste one more year applying for an East Coast university, for instance, some people take the decision just to travel, so it's not easy.
So
It's life changing.
now, guys, we are applying to school. Now we are in the process of applying to school. Now, getting to school, being in school is another whole
definitely,
thing different. It's super tough. I mean, for us, for like people like us that we are international students. Like I'm from Peru, he's from Syria. So, I think I consider school super difficult. I mean, it was super stressful.
Of course, it's stressful, but you get to the point. I would say, doctor, you have the stress that's got a little bit released from just predicting the future if you would have been accepted or not. So at this point, you will have like more power to continue, and more. You will be, spending your time like practicing dentistry. You'll spend your time studying dentistry, and eventually you wanna get the license.
Yeah.
So-
I don't know if you can share with us a little bit, because before we're gonna speak about a case that we did together like 2 weeks ago. But I want you to share with us the your experience, like how hard was like inside school.
I mean, of
Like
course.
for me, I'm sorry to interrupt you. For me, it was super difficult. Like my routine was waking up 7 a.m. in the morning. Remember that the exam that we have to do at 7 a.m. in the morning. Then 9 a.m. in the morning, cleaning up to 5 p.m. That's cruel.
Of course. I mean, for me, maybe the commute was one of the challenge as well.
I don't know what you
Because
do. I don't know how you did it, man. He's
So
from New York.
I live in New York. I have to drive almost like an hour to get to Newark, to Rutgers University every day. So let's say if we start the board exams or any exams at 8 o'clock, we have to be there like 7 o'clock. I have to be up
crazy.
5 o'clock in the morning. I have to commute. I have to make sure that there's no traffic. I have, coming back, I wouldn't care, but going to the school.
Coming back is
yeah.
also hell, yeah.
But
Yeah.
again, the school, in generally speaking, the school, a lot of stress coming from the practical part. And there's another stress that's coming from the theory part as well. I would say it's different from school to school, but at least in Rutgers is a great school. They have a
Definitely a great school.
Yeah, they have a great clinical program as well, and you have to be
A nice curriculum.
yeah, and you have to have this 3 months when they in the clinic when they prepare you before even you getting to the right deal.
Yeah.
So that was
That was hard.
condensed.
That was hard.
hard. That was intense.
I think
actually.
that was hard. That was hard in that position. On now that we are in university, we are about to finish. Now it comes to us another stress, right? You finish your career now. What you gonna do?
I would say in dentistry is always there's something new. Always there's something to learn.
But thank God, guys. Thank God, God put my friend in my way. Remember, we graduate Monday. We graduate Monday 11 a. No. Sorry. We graduate Monday. And we have our first patient
3 o'clock.
3
Tuesday.
o'clock. No, we have our license at Monday 11 a.m.
We graduated Monday, and we had our license Tuesday.
and we have
started
our
patient
patient
3 o'clock.
3 o'clock Tuesday. But I said to Dr. Taweel before, even 1 year before, I bought this practice 1 year before we
1 year,
finish.
1 year before.
And I brought you here and I show you the practice. And I told you, listen, I want you to be with me in this journey because I'm not gonna be able to do it. Even though in this new project that I have, Dr. Taweel, I told him, listen, I want you to be part of this project too because I'm not gonna be able to do it myself. And in top of that, I always say it doesn't matter how good you are as a dentist. I don't know how fancy you are as a dentist. I don't know how many skills you have as a dentist. I prefer having as a partner a person that I can trust. So, and I think this is very important. Let's talk about Victor.
Yeah, Victor is a very nice, very nice and interesting case actually.
So what you can
I would
say
say
about
it's challenging.
it was challenging.
From the beginning, actually, if you see the malocclusion that he has a skeletal, I would say like
Class 3.
class 3. He has a very bad periodontal disease. Have lost a lot of teeth,
You had the X-ray there.
and he has significant bone loss
Yeah.
in a very strategical area. As an implantologist, you want to just like implant and implants, and you see there's no room for the implants, and you get frustrated. You want to look for where's the bone, how I want to supposed to plant the case. So from the beginning, it wasn't an easy case.
I think it wasn't easy, but the flow that we find here
Yeah.
in our office is
course.
very interesting because what we do here, we do everything digital. So this case was planned since A to Z digital, right? We even before surgery, like I show in the video, we have everything planned. We have how the denture, how the occlusion is gonna be at the end.
I mean, nowadays, with the flow that we have, everything is predictable. We're not doing anything with no predictability. So our surgical guide, our prosthesis, our implants, the size, the diameter, the blend from A to Z, it's pre-made.
Yeah.
And we're just going with the exact plan.
Yeah.
Sometimes such a cases, we have to change a plan. And this is one of the challenges as well. We
Definitely,
have to change
we have
a
to
plan
change this plan.
because sometimes the CBCT can tell you accurate things sometimes, but what I find from my experience, as soon as you get into the bone, sometimes you find this granulation tissue that's hitting here and there, and you have to take it out. You have to change
You
your
have to
plan
take
because in the
decision,
middle
yeah.
of the implants, actually, that's what we face. And the
We
both-
face a lot of problems with
and the two
Victor.
implants that we place in the front, especially. Like
And
8
remember
and
the
9.
two that came out falling off in the air?
Yeah.
Man, that reaction of the patient, you just catch the tooth in the air.
Yeah, that was funny.
It was funny. So this is very nice thing that we do when we do surgery.
Yeah.
I think like me and you, we enjoy what we're doing. So I think when you enjoying what you're doing, it doesn't become a job anymore.
Yeah, it's
just
something to enjoy.
It's something that we enjoy.
And the best part of it, the final, when you see the patient smiling, when you see the
Oh my God!
the
You
impact in
you
their
made
life.
me realize today in the video that we made at the end. Do you look at our faces? How
The thing, we were so tired.
how tired
I mean,
how tired we are.
we were from 7 o'clock. We finished almost at 11. But again, the actual
No,
the
11,
actual,
man.
you
It
know,
was
no,
it
so-
was 7. It was 7 p.m. 11, like we were celebrating my daughter's birthday.
Yeah, I mean, again, we started early. We finished almost there,
Yeah.
around that time. But again, the problem here, is you don't feel you're tired
You
while
don't
you're
feel
working.
you're tired.
you
You
know.
don't feel you're tired.
As soon as you finish,
You don't feel you're
you
tired.
feel the pain. But
You know when I feel I was tired? In the restaurant. After we finished here, we were celebrating my daughter's birthday. Now, like when we're about to finish, I feel tired.
but because we decided this time to do everything from scratch here,
Yeah,
we want to try our new project, our digital lab.
but it was good. Right?
It was amazing actually. The actual time of the surgery is not that much.
It's not that much. No.
So when we say, guys, from 7 to 11 or from 7 to 9, the patient at that time, he's in the recovery room. He's sitting.
he's
The
sitting.
actual time of the surgery itself,
I think 4
I would
hours.
say it ranged between like.
If it's 1 hour, 2
it's
hours.
1 hour,
If
2
2 hours,
hours,
4 hours. In
3
his
hours.
case, was
To
2
be
hours.
honest with you, the more time we take to do the GBR, to do the grafts, and to do the suturing and to close the flap, more than the actual time of placing the implants. But again, what take time this time, it was as well something we would say like something new, right? is fabricating the BMMA
Yeah.
and glazing it and coloring it and doing everything
And
from
I
scratch
and
in
I
the
and
office.
I know people can say, oh, I mean, I know people doesn't think that this is easy, but I know they don't know the stress that you have in your
Entails a
shoulders
lot. Entails a
because
lot.
you
Yeah.
tell like our presentation to the patient when we do the consultation, we offer your smile, your change in one day, and that's what we're doing. We
Of
do
course.
extreme makeovers in one day.
Of course.
That sounds easy, but it's a lot of
A
stress.
lot of stress, and there's a lot of measures as well. In order for you to load teeth in day, there's a lot of measures. So our patients' expectation to load them, but they don't know how precise you have to be in order for you to load a PMMA and implants in one day.
Do you feel nervous when we did this case?
Not really. I mean, we always, every case that we do, maybe it's not the first case.
I did in the top.
Yeah, maybe.
Remember we said that should be easier?
Yeah, it's
Man,
not the
when
first
we-
case, but always we treat any case as a first case because
That's
almost
important.
is something
That's
new.
important what we do.
Yeah, it's almost there's something new,
Yeah.
especially in this case. For example, the hidden tissue in between the area in the front.
The granulation tissue.
The
around
hidden
the
granulation
implant,
tissue
man,
that just looks
kills
like,
me.
it was like subcrystal and it was
So we
literally
put the implant,
looked like
guys.
bone,
We
yeah.
put the implants, and after we put the implant, we're about to finish. We realized that
we were sitting in the office actually
we
having
realized that
some
we
coffee.
need to take the
Yeah.
implants out to replace it for another implants to clear infection that we didn't see.
I would say that the CBC didn't show it. However, when we see like some sort of bleeding around the implants, when we saw some something a little bit funny around them, which is we never seen, we have to take out. We have to clean very well, and it was in the granulation tissue actually were mixed with
It was
different
big.
things. I would say yeah, it was.
But
it was
hopefully
pretty
we manage. We manage
yeah, we
very
managed,
good.
of course. We managed very good. We grafted the side. We replaced the implants with different diameters, and we managed to get the stability, and we take the decision to load it the same day.
I think the important part here, Dr. Taweel, is to make people think that everything is possible and that we are two professionals that we're going to do everything in our power. In our office, it has everything.
I mean,
we are equipped with the best top of the line equipment.
this is something very important. Okay, everybody have to realize, the equipment that we have, the equipment, the flow, the professional who's working in the case. I mean, maybe you guys see me and Dr. Romani here, but believe me, behind each arch that we're doing up here, there is a full team. Full team.
It's
not
a
just
lot
like
of
us.
people
There's a
involved.
lot of people involved from here, from out of the seas, professional people. I mean, before the case, I would say like a week before the case, the planning start, the discussions, the changes, everything, we get to the point that everybody agreed, everybody double check everything, and we get to the point to fabricate our guys and to fabricate our BMMAs. Before
And
the
still
surgery.
surprises come out.
Of course, always you have to be ready for any surprise.
Yeah.
I mean, managing the patient, one of the most important thing as well, I would say.
Again, if you trust the people that you are working with, I mean, this is the most important part. That's why I think I consider my surgeries. I mean, we enjoy surgeries.
Yeah. I mean, it's possible. It's not something somebody you're not supposed to consider because you think it's something tough to do. But again, you always can trust us. You as soon as you're in our chair, you are part of our family. Whatever we're gonna do for you is whatever we're gonna do for ourselves, for our family member. So believe me, I mean, these cases life changing for everybody who's willing to
Extreme makeovers.
of course, for everybody who's willing to get new teeth, to figure out a new smile. If you have periodontal disease, if you have loose dentures, if you have bad teeth, you want to improve your smile, there's always a way. There is always a way. If it's impossible, we'll try to make it possible. If it is tough, we try to make it easy for you guys. Our cases can speak, to be honest with you, and
Just trust us.
hopefully, of course, it's trust. But again, entails a lot. During the whole entire procedure of fabricating the full arches,
It's
a
tough.
lot of efforts from a lot of people.
Yeah.
And nowadays the digital workflow make it predictable.
Easier.
And that's
Easier,
what we like about
predictable,
it. Yeah.
and we rely on that.
Mm-hmm.
So, guys, like I always say in my consultation, you just need three things to make these procedures done. The first thing, I always say, you have to have the willing to do it. You have the willing to do it to change your life in one day. If you give us the opportunity to change your life in one day, we're gonna make this dream come true. Second thing is you have to trust us, because even though we look young, we have kind of experience. So, and the third thing, yes, it's not a cheap treatment. It has to.
It's not
People
cheap
have to
treatment.
know.
No.
People have to know that there is no. There is, and not this treatment is not a cheap treatment. But here in our office, we can help you with everything. We're gonna make it possible. So
It's affordable sometimes with the different, with the different options that we have.
yeah,
But again, there's a lot outside. If you compare, you will know the difference. There's
definitely.
a lot outside. I wouldn't say it's super cheap. I wouldn't say it's too expensive, but it's worth it. That's what matter eventually.
If it worked for you, I mean, if it's important for you to change your life in one day, we can make it possible.
Of course, we
And
can
the
make it
money, the money is just something that we can help you.
possible. Of course.
Something to say before we
No,
end
I'm
this
actually
conversation.
just thankful for you, and I'm so happy.
And we have good plans coming out. Future.
We have good, nice, beautiful plans actually. We have very nice. I'm so excited for the new plans. Working very hard, me and Dr. Romani, in different projects actually in dentistry, and hopefully we'll extend this service.
You're gonna be with me.
Of course, we're gonna extend this service hopefully for the whole East Coast.
Definitely, guys. So thank you so much for listening, for try to learn about something about dentistry, even though it's boring. But we are here for you. We can help you. And any advice for people like they wanna become a dentist here and they see this dream impossible.
You have to start. You have to start. Don't think about from where, how. You have to push yourself out of your power. You have to do a lot of research before you start to study, because the resource is very important. Don't waste your time. If you want to do it and you're skeptical about it, just do it right now. As well, me and Dr. Romani here, our website, our contact, you can always, guys, reach us, and we are more than happy to help any international students, any regular students who want to be a dentist. So we can try to give you from our experience, and we are happy to help.
The only thing I wanna say before I leave, I will say, if you wanna become a dentist here, if you wanna be a professional here, you have to have just one thing. I always say persistence. I think persistence is the
discipline.
most important part. If you wanna make it possible, you wanna make it possible. You just have to have the willing to do it and persistent. Sometimes you wanna be feeling like quick, right? Because it's difficult. The path is difficult, but if you are persistent, if you are disciplined for whatever you decide to do, you wanna at the end of the road, you wanna get it. And
Of course.
and the enjoy of whatever you sacrifice are gonna be worth it.
Of course, persistence is the key of the success in this career. Actually,
I mean, we love dentistry.
it's everything for me.
On top of that, I know at least you know how to cook.
Of
I don't know
course.
nothing about dentistry, nothing besides
Listen, we
dentistry.
don't even
Believe
have-
me,
we don't- we don't have even time.
if I damage my hands, I always say to my wife, if I damage my
We
hand,
don't even have
what I
time
would do,
these
man?
days.
Nothing.
Yeah, again, it's good after like a stressful day.
At
to
least
go-
at least you can work in the kitchen or
To go
something, man.
fry
What about
some
me?
eggs.
Nothing. So, guys, we are the faces behind smiles. Thank you so much for listening, and see you in the next chapter.
Thank you so much, guys. Thank you, Dr. Mani.